But we begin, though, with insuring your health care. There's some new numbers out from the Census Bureau that show the number of people without coverage was up again in 2010 to nearly 50 million. So, if this doesn't affect you directly, it probably affects someone that you know. We want to try and give you some help today. Andrew Rubin is with NYU's Langone Medical Center, and he joins me now from New York. Welcome back to the program, Andrew. Thanks for being with us.
Good to be here.
Let me ask, first of all, does it surprise you that the numbers went up a little bit? They say it wasn't statistically that significant. Does it surprise you that it didn't go down, or it is where it's at?
Well, it's where it's at until 2014, assuming the health care reform legislation stays intact, when most people will be able to get insurance that don't have it today. It didn't surprise me so much, but Sanjay, think of it this way. While it only went up 1 million people, and that's a lot lower than people expected, think of it like 12 football stadiums filled with people that lost their health insurance last year. So the numbers are still pretty big. They didn't grow that much because the unemployment rate between 2009 through 2010 was already pretty bad.
And to be clear, so if you have a job and you have COBRA, it lasts for 18 months afterwards. If you find another job, you can get health insurance there. But what if you don't have COBRA? Correct. Or you can't afford the premium?
Hey, that's a big problem because, most employer health insurance is subsidized by the employer, and when you lose your job and go on COBRA, you lose that subsidy. And then in the Stimulus Act a few years ago, there was money available to subsidize those premiums. That money's gone. So a lot of people, just don't have insurance. So what they should do, because they can't afford it, what they should do is go into the insurance markets, assuming they don't have a pre-existing condition, and a lot of people do. But if you're one of the lucky people who don't, you can find a much less expensive policy, one with a higher deductible, one with higher co-pays, whatever it is. There are less expensive policies than employer-based policy. But the key is you want to have something if you can get it. If you're one of those unlucky people who has a pre-existing condition, the options are much, much more narrow.
Along those lines, I want you to take a quick listen, Andrew, to something that just about everyone seemed to agree on at the recent CNN Tea Party Republican debate in Tampa this past Monday. Take a listen.
The bill to repeal Obamacare.
Because we cannot go forward with Obamacare.
I will use an executive order to get rid of as much of Obamacare as I can on day one.
First, repeal Obamacare in its entirety.
Amen.
And a waiver from Obamacare to all 50 states.
I mean, I think you get the point that we're trying to make there, Andrew, by showing that clip. I mean, they all want to repeal what they're calling Obamacare. But what is the alternative that you know of? What happens to all these uninsured Americans if the Republicans are successful in overturning President Obama's health care reform?
Hey, listen, it makes for great politics, right? But the fact of the matter is the country without health care reform, whether you like it or not, we needed to reform the existing system. You can't allow a country of our size to have 50 million uninsured Americans. It's just dangerous for the economy, and it's dangerous for individuals who really need the health insurance in this country. So we actually must get some more specific and concrete answers out of these Republican candidates to actually tell us what they're going to do. Consumers need to be able to have that level of protection. Americans need that level of protection and understanding, and we're not getting yet. As a health care executive, hospitals, doctors, we need to plan for the future. We need to know what health care in this country is going to look like. And right now, we don't have any answers.
Well, there's some tough questions that need to be asked, and certainly I think a lot of those folks who are talking about health care are going to get those questions. Andrew Rubin, thanks so much. I hope to have you back. Now,